was very excited to know that it would be 4 little incisions and that it would be easy to heal.
I was actually happy I was going to do robotic surgery as opposed to the old-fashioned way where they cut you from here to here and open you up and then pull organs out of the way to get to your prostate.
It was so easy, especially doing the laparoscopic surgery. I had 4 tiny little incisions that kind of go up here around my stomach, and you can't even see them anymore.
He really put me at ease, even just the hospital staff and everything. I was very comfortable.
He seemed to really care about me as a person.
But I'm really glad that I had Dr. Smith to be able to go through this process with.
My name's Corey Smith. I'm an OBGYN. I've been practicing in this area for a little over 6 years. I love to practice rural medicine. I like seeing my patients and interacting with them and really getting to know their stories and just being able to help them attain the care that they deserved.
My name is Chanda. I am a native of Harrison. I've lived here my entire life. First visit, they suggested an ultrasound to see why I was having problems, which was never even brought up as an option with anyone else. Dr. Smith found my problem, gave me options, and explained everything very thoroughly. He said, we can do this now, we can do it robotically in very minimal invasion. No, I wasn't worried about the surgery. I felt completely at ease and knew that everything was gonna go great. I got to come home that evening, so I didn't have to stay overnight, which was nice. I had minimal pain, I feel like, for such a big surgery. So that was wonderful. I was up and moving around after a couple of days. I'm pretty sure Dr. Smith is the only doctor that I have ever pushed onto any of my friends like I have. But like I said, I've referred 3 of my friends to him and they have all been so happy.
I've always made it kind of a point in the mission to really connect and relate with each patient on, really a more human basis. So I always try to make sure patients are comfortable, that they have the information that they need, that they understand, the treatment, the evaluation. I just try to spend a lot of time with patients and really educate them and just answer any questions they have. And, I always try to make myself available to patients pretty much, more or less around the clock. So I think that just goes a long way to just building that relationship and building that trust with patients.
My name is Cisco. I live towards Alpena, between Harrison and Alpena. Several years back, I had a slight cancer scare, so my friend recommended Dr. Smith. He was very thorough. He ran all the tests. He even double-checked some of the tests when the lab work didn't really match each other. And what I really liked is I got to bring my husband, and so he just talked to both of us. He did focus on me, but I wanted my husband there for support. He really put me at ease, even just the hospital staff and everything. I was very comfortable. To be honest, I thought it was more of a normal practice now to use that type of equipment than it would have been, 10 or 15 years ago. So I think it was more so trusting Dr. Smith, knowing that I had friends that had seen him and had recommended him, and he shared his experience with me, and I was very comfortable with him as a surgeon and his ability to operate the machine.
I think what it really comes down to is options, local at home. So we want patients to be able to get the treatment that perhaps in the past they've had to go outside the community for, and that they can get that treatment here at this hospital. The Vinci essentially allows us to make small incisions and really to have 100% control of the instruments as the surgeon, and really, magnify our vision, get 3D vision. It makes it a lot safer for the patient, makes their recovery time quicker, less pain, less post-operative pain, so that they can get back to the activities that they love and enjoy a little bit quicker than perhaps by other means of surgery.
Hi, my name is Peter Giuliano. I'm 76 years old. 12 years ago, I had my prostate removed by Dr. Decker. We had a long talk. He decided to do a biopsy. When the doctor tells you have cancer, it's a pretty shocking event in a person's life. So we scheduled the surgery. My surgery was done with the Vinci robot. Of course, I'm not an expert in robotics or anything, but it's kind of nice because your body isn't cut open and your organs aren't exposed. They just make a few little slits and insert the robotic instruments through those slits into your body. A lot less chance of infection. And the robot doesn't have a shaky hand. It's rock solid. I was given pain pills to take after the surgery, which I never took one because I just wasn't in any pain. It was the best decision I made, having Dr. Decker do it.
How you doing? I'm Dan Decker. I'm a urologist. Work here at NARMC for last year or so, but been taking care of patients in this community for over a decade. I've been living in the northern Arkansas area for 13 years and have been practicing rural specialty urology that entire time, which I think is really relevant to what we're trying to do here, is to bring a surgical technology that most people have to go to cities for. You can go to a city and have minimally invasive surgery, but if you're coming back and you got a 2-hour drive, bringing robotic surgery to your doorstep really completes the process. None of these surgeries are new procedures, it's just a fancy tool that really has changed the game for a lot of the surgeries that I do and Dr. Smith does. One of the beautiful and positive aspects of living in this part of the country is the rural and the isolation, and a lot of the patients like that, but one of the negative of that is there's some things that you need to get in the city, and sometimes it's healthcare. But if we can do everything that they're doing there, but more personalized, and this isn't just, hey, we're just going to try this out and see how it's worked. We've done it. We've done it and proven that it can be done, and you know, want to expand that here.
You know, he made me feel heard, and he listened to my concerns when I had seen multiple doctors that just kind of dismissed it because that's what being a woman is.
He seemed to really care about me as a person.
He actually sits and listens.
Whatever he needed to do to take care of it, I had full trust in him.
I don't feel like he's ever rushing me to get through an exam or a visit.
I really like this doctor. I trust him, and I'm going to be a person. Everywhere else, I'll be a number for the day.